नमस्कार दोस्तों, मैं डॉक्टर पूजा कपूर। आज का हम जो है अपना लेक्चर जो है वो इंग्लिश में करेंगे। सो दैट मीन्स वी आर गोइंग टू टॉक इन इंग्लिश बिकॉज अ फ्यू ऑफ आर जो हैं they are requesting for an English version of this. So today we are going to talk on the role of medicine in autism spectrum disorder. So we all know it that we don't have a treatment by medicine for exclusively the core symptoms of autism spectrum disorder. And what do you mean by the core symptoms of autism spectrum? Means sensory phenomena, recurrent fixations, and non being not so social as required age appropriate. So these are the core symptoms. So the medicines are not going to help you in becoming social. The medicine are not going to help you in stopping the fixations, and the medicines are not going to help you in getting the stereotypical phenomena fixed. So if these are not used or not useful in my autism spectrum disorder, then what is the role of medicines? So 50 to 90% of the children with autism spectrum disorder have sleep problems. That means they have either problem in the initiation of sleep or in the continuation of sleep. By initiation, I means if I make my child go to sleep at 9 o'clock, but he sleeps takes 2 hours of going into sleep, that means there is a problem in the initiation of sleep. Whereas the continuation of sleep means if I go to sleep by 9 p.m., then by 12:01, I get up. I get up and then I ask for milk, or I just start playing, or I just start crying. Then maybe after 20 minutes, after 1 hour, after 2 hours, again I go back to sleep. And then again I get up at 4, 5, and then I play, or cry, or ask for milk, and then again I go to sleep. So for these things, I require medication. Why do we require medication for both initiation and continuation is because sleep is the phenomena by which once you go to sleep, there are two forms of sleep: REM sleep and non-REM sleep. That means rapid eye movement sleep and non-rapid eye movement sleep. So that means during these two phases or do these two types of sleep, what is done is that whatever we have done in the morning throughout the day, the superposition of the memory happens during these phases of sleep. So, if you don't get sleep enough or you get interrupted sleep, then whatever you have learned in the throughout the day will not get fixed into your memory. You will have no memory connect of whatever you did throughout the day. Same thing happen with us also. If you do not sleep at night properly, you are groggy in the morning, you're not fresh, you're not able to recall whatever happened. In fact, you are not able to get whatever is happening today also. So that is why in our children, to make our therapy session better, to make them learn earlier, to make them recall, to have a good memory of whatever has been taught the previous day, I have to have good sleep. And because as we know that sleep problems are there in autism, so definitely we have to give the medication. The medication of choice is melatonin. So, what happens is, as soon as we close our eyes and lie on the bed after closing the light, and then there is a hormone called as melatonin, which is secreted from our pineal gland over here, just behind this. So, because of that, that helps in the initiation of sleep. And it has been very well studied that all the children with autism spectrum disorder do not have the good quality of melatonin to make them sleep. So that is why it is given in outside countries, basically in US and all. The melatonin is over the counter medicine. That's a OTC medicine. Here in India we get it in the prescription, but it has no side effect as documented till date, and you can give it under the prescription of the doctor in consultation with the doctor consultation. And once you have good night sleep, there are chances that the day would be much better. He would be less cranky in the therapy, he would learn more, his retention would be more, his memory would be better. So don't be afraid of giving melatonin to children who have sleep concerns. Just talk to your doctor and talk to them and get the prescription. Okay. Now comes the role of ADHD with autism. So previously the term was only autism, autism spectrum disorder, but now we have that two things can be together in the form of ADHD and autism spectrum disorder. So what is the thing? So when our child has a lot of movements, he's all over. And what we have seen is as soon as we start therapy and the symptoms of autism starts going in, the end stage of symptoms what are left is with like is ADHD. They move around, they start speaking also, but then they just move around and all over they are there. They are not listening, they are under the table, they are over the table, they are there, they are on the sofa jumping. So once you have this, it becomes very difficult both for the therapist and the parents to manage the show. So what is required is we can give medicine for ADHD. So most of our parents are scared. I don't know where this myth is that once you put the medicine to the child, you have to be lifelong on that. The second myth is if you give the medicine, your child will become groggy, your child is not going to attain anything, he will just sleep down. So, my friends, the thing is that we don't want to make our children groggy, or we don't want to make our children go to sleep. We don't want our children to be just be limp in their sessions. But we want that there has to be a balance between their hyperactivity and their lowness. So, the dose of the medicine has to be adjusted accordingly. So, for ADHD, there are two, three medicines which are there. Most of you must have heard the name of the medicines, but I am sure of you must not have tried thinking of कि पता नहीं क्या होगा हमारे बच्चों को, what's going to happen to our children if we start with the medication. But then I have a lot of happy parents. The crux is you have to be sure what you are starting with. The crux is the medicine dosage. So every child is different, and you start with a very minimal possible dose and you escalate according to the needs of the child. So suppose there is a medicine called as methylphenidate which comes under different names, and this is very good medicine for ADHD children, and you start very slow, very slow. And you can obviously report to the doctor once you start seeing any irritability, once you start seeing any gastric symptoms with it, once you start seeing that the child is not eating or the child is sleeping. So what we can do, we obviously can reduce the dose, we can shift the dosing to at night. Generally it's given in the morning after breakfast. But in few of the children, maybe 5 to 7% of the children, this can cause sleepiness. So what we do, we make it shift at night so that the child sleeps after taking the medicine, and the morning he is fresh, but he is not hyperactive as such, and he is manageable in the school, in the class, in the therapy session, and at home. We can give weekend or drug holidays also, because medicine holidays can be given if he is at his grandmother's place, if he's at his home, there's no school, you don't want him now, there's no sessions, and you just want him to play, he's there in the playground, it's a Sunday, so you cannot give that medicine. So we have to manage the child with the minimalist possible dose by which my child is able to perform and learn every day new things. So what we do is like we take off the medicine after every 6 months and see how the child does. If the child has achieved a level which we want, then obviously there is no need to start the medication repeatedly. These we do during the holidays, summer vacation, winter's vacation, the Shara holiday, something where we can judge the child and can find out, because we don't want our children to be slump, or not understanding whatever is happening, or slowing down basically. No, we don't want that to happen to our children. So you can manage that, and with that dose you can just talk to your doctor, stay connected to your doctor, and then you can reach to a level where both of the things are well managed. The other medicine for hyperactivity is atomoxetine, or Accepta. It comes as a trade name. Most of them of you would be using it. Again, this is to be given in the morning, and sometimes again 5 to 10% of the children are sleepy, so we give at night. A minimalist possible dose is given so that my child doesn't become irritable or sleepy. So at times these medicines have gastritis concerns and the irritability. So today only I stopped one of the child with the medication because it was started and then the child became irritable, and then we stopped it now. So it's okay. So the thing is, like, you have to be smart enough to know that okay, this because of this medicine only. So before that my child was not irritable, but as soon as we started he became irritable, so we'll stop it. Okay. So now the next medicine which is there is called as risperidone or aripiprazole. Again, the mechanism of action is through, it's an atypical antipsychotic medication. And here also we want to make the child go off from the sensory concerns. So once we have a lot of sensory concerns, we can use these two medicines. These two medicines are generally used at night because their side effect is sedation or sleepiness. So once you give it at night, it is okay. But if my child is all over and there's a lot of huge concerns, then definitely you can give this medicines in the morning too. It start acting, it lasts, the effect lasts for 4 to 6 hours, but the sedation can last long, and that is why we give generally these medicines at night, and a small dose if required in the morning. So we start with few drops and go on. Again, every child is different, so we start, some children do well with 6 drops, some children do well with 12 drops, and so on and so forth. That's 0.5 milligram, 0.25 milligram, 1 milligram, depending on my child and what are the symptoms are. So these are again for the sensory concerns. This is for the sleep, and the other one is for the ADHD medication. So there are other ADHD medication also, which is also called as Arcamine. Then there are medication which are used for the anxiety. So a lot of our children have anxiety, and because of that they have all sort of behavioral concern. They will start crying as soon as they will enter the therapy session or therapy center. They will become very, very, very cranky once they entered some place which is very crowded. So it's a lot of anxiety. So for anxiety also we have a different medication. And but mind it, all these medication have to be used in sync with your doctor, so that you know the effect and the side effect, when to stop, when to start, when to decrease the dose. So because this is a journal session, I'm just giving you a glimpse of whatever medication which we are using in and out. And but you should obviously don't do it by talking on just groups to the people. It's a request, please, it's a request. Don't give it just talking to the parents, because we treat it accordingly, that what are the needs, why, when, how, and explain you what could be the positive side effects and the effects, and when to stop the medication. Now, this is the role of the medication which we have. Then there are other things which we call as nutraceuticals. Nutraceuticals, I mean those things which are not used in a medicinal form, but they are used as a supplementary form in children with autism spectrum disorder or ADHD medication. So, what are these medicines? So, first is DHA and omega. So, make sure that whatever medicine you are giving does not have a lot of sugar content, because if this would be a lot of sugar content, they become a lot of hyper again. So DHA omega is very commonly used. There are studies which says that this helps in my cognition. It helps in making my child uh, become better in the form of inattention and hyperactivity and soothes the child. So definitely you can give it, and there are as such no reported side effects of DHA and omega. There are multitudes of brands which are available, but there are few which have like come in a jelly form, jam form. So those are obviously rich form in sugar. So make sure you don't give a lot of sugar along with that. The other thing is you can use which we call as L-carnosine. So this is again a studied molecule, again a nutraceutical, and this again when again given in a very high dose, because of the sugar content, I've seen in my practice that they cause a lot of hyperactivity. So make sure you don't give it in a lot high doses. Lesser doses is good. And again, these are quite expensive medicines, so make sure these are not going to help you a lot way. These are responsible for 5 to 10% of the changes which your child could get, but the main thing is the therapeutic intervention which you are doing. So don't just put all our don't put all your energies on the medication, because they are not responsible for bringing a dramatic change in your child. They are responsible only for 5 to 10% of the changes. That's all called what you call as nutraceuticals. And apart from that, there are no other medication which can help you to get you the core symptoms corrected. So mind it, don't get it in the way that my child has become cured because of this. So please don't lose the right track and go into another track which is not going to give you a lot of results. So at the end of this, I am also going to attach a few snippets of the program which was held at All India Institute of Medical Sciences. There was uh, their information in the newspapers for autism spectrum disorder. So I'll send you the clippings of that. Those are authenticated information which has been dissipated by Dr. Shifali, and I would really would like to quote on that, and also would send the all the snippets on this. It was a 1.5 hour program, but then I'll just cut you the snippets and give you whatever is required in the treatment modalities. Okay, so now that's all for today's thing, and let us go to questions. And I was reading these questions before, and I'm so happy to hear to see this, that people are putting up the questions in a so good way. It's so explanatory, and that give you the glimpse of the child. I can just visualize the child in front of me just by the written comment. So Mithu Dairy, who have posted the question at 3:18 p.m. itself today. So, ma'am, my daughter is having autism. We are doing her treatment in CMC Vellore. She's 6.9 years. Her other skills, including learning, self care, is improving nicely, but speech level is like 2 years old. She's having need based speech. She can tell her needs, her feelings, but she doesn't answer properly. Sometimes, if I ask her to say something or repeat names, she directly says, I don't want to talk. She doesn't have consistency on repeating words or sentences. Whatever she learns from the daily life, she expresses this in one sentence, like I want ball or I want water. She is following three-step comments. So I really appreciate how you have written down, and because I could get the glimpse of the thing. So my child is 6.9 years. She has got autism. She is very well learning. Her learning graph is good. The only concern is the speech is like only localized to 2-year-old child and need based words, and she uses only 3 to 4 word sentences. Mommy, the take home message is, are we doing speech therapy? I want this to go a lot with speech therapy and along with social stories. Because just keep your things, because your child is so good, 6.9, and she is like started speaking, understanding is good. She will speak. Okay, the thing is, you have to have good speech therapy, and also social stories and constant engagement, because these children have that inherent tendency of not speaking. That is why your child is saying, I don't want to speak. So no matter how she tells you she don't want to speak, but if you engage her in all day practical things in the form of, okay, so how is she looking? Just get me your doll. So how is your doll looking? Is she good? Is she bad? Oh, is she looking beautiful? So, by just talking to her in small sentences, I just want to feed her with a lot of vocabulary. And what can you do also is, suppose there is a ball. बॉल कहाँ फेंके, बॉल कैसे खेले. सो जब आप ऐसे बोलोगे तो जो है कुछ उसको, और उसके बाद देन व्हाट यू हैव टू डू इज गिव द आंसर टू. बॉल हैंड से खेलें, हैंड से. You are showing a picture, you are doing the thing, or also you are putting up a question. So the thing is like you get a correlation with what you are doing. So they say that the research says by the age of 10 years, and your child is speaking, your child is just joining three words together, four words together. So obviously you have to keep faith, and now start, instead of what is this, what is this, what is this, now start using these words, whatever she has learned from the noun, in other different aspect. Like, chalo, let's make the doll sleep. Okay, Nina Nina. Okay, now where do you sleep? Let's go to the bed. So small sentences, but those which you haven't used in very frequently. Because what we make our child do is like, ye kya hai, what is this, what is this, what is this, high five, chalo, okay. But now you have to expand her vocabulary, and those could be done by everyday needs based things, and then expressing in a different format. You can also use storybooks, because storybooks give a lot of vocabulary. But just keep faith, your child is going to speak, because whatever you have done in a very wonderful way. Because 6.9 years speaking like this, I have high hopes. And obviously she must be going to school, so that also helps, because children want to learn to with children. Now she is of the age, now she is of the caliber, now she is of that where she can really imbibe from other children. So definitely school is going to help, and also using the day to day activities and adding words to that, and along with the question, is going to help her in a better way. Okay, so let's go to next question. Shobia Sheikh. हेलो मैम, मेरा बेटा 3.3 इयर्स का है. डॉक्टर ने एएसडी एंड डेवलपमेंटल डिले डायग्नोज किया है. 2 मंथ से ओटी चल रही है. इम्प्रूवमेंट भी अच्छी है, बस स्पीच नहीं है, बैबलिंग करता है, कभी कभी खुद से बिना किसी बात पे रोने लगता है. सो मम्मी, अभी जो है अभी डायग्नोस हुआ है, बट आप बोल रहे हो कि इम्प्रूवमेंट है. अभी स्पीच आएगी, पहले कनेक्टिविटी आती है. अगर घड़ा खाली है तो उसमें कैसे से कुछ हम दे पाएंगे. तो पहले आपको घड़ा भरना है, मतलब उसके अंदर पहले कनेक्टिविटी करके स्पीच डालनी है. अगर इम्प्रूवमेंट आ गया है आपका जो है वो ओटी से, तो आप अब स्पीच थेरेपी में डाल सकते हैं. क्योंकि जो है आप बोल रहे हो इम्प्रूवमेंट अच्छा आया है 2 मंथ्स में, तो आप स्पीच में जरूर डालिए. और अगर वो बिना खुद से बिना किसी बात पे रोने लग रहा है, हो सकता है वो सेंसरी फिनोमेना ही हो. क्योंकि जो है इनमें भी कई बार पे बच्चे बगैर कुछ कारण के रोने लगते हैं. तो जो आपके ओटी हैं उनसे ही कनेक्टेड रहिए, क्योंकि अगर इम्प्रूवमेंट आ रहा है तो उनसे कनेक्टेड रह के आगे बढ़ते जाइए. बट अगर सेटल हो गया है बच्चा, समझने लायक हो गया है, बैठने लायक हो गया है, कनेक्टिविटी स्टैब्लिश हो गई है, तो स्पीच में डाला जा सकता है इस बच्चे को. ओके, लिटिल समर्थ. हेलो मैम, अ वेरी गुड इवनिंग. वेरी गुड इवनिंग टू यू ऑल्सो. My son is 5.2 years, studying in normal school in class nursery. Main concerns is speech delay, but speech is improving day by day, giving Espirito, Dio Sharp, and L Carnosine. His hyperactivity is almost gone, but not potty trained. Doctor said ADHD. Okay, so the thing is, देखिए again 5.2 का हो गया है और हमारा अभी स्पीच डिले चल रहा है, तो खाली स्कूल के साथ साथ थोड़ा सपोर्ट सिस्टम भी इस्टेब्लिश करिए। या तो आप घर पर आके उसकी स्पीच खुद करिए या फिर स्पीच थेरेपी सेशन में डालिए। क्यों? क्योंकि जो है अगर जो है बच्चा जो है अब स्कूल की पढ़ाई एकदम से बढ़ जाएगी, फिर आपके पास समय नहीं होगा बच्चे को जो है ये जो पीछे का जो मेरा बैकलॉग है उसको खत्म करने का। तो अगर हम उसको नहीं खत्म करेंगे तो आप सिर्फ पढ़ाई के में चक्कर में रह जाएंगे और हमारी स्पीच डीले की डीले रह जाएगी। क्यों? क्योंकि जो है अगर हमने ध्यान नहीं दिया, हमारा पढ़ाई का कोर्स एकदम से बढ़ जाएगा। हम फर्स्ट में जाने की तैयारी कर रहे हैं, फर्स्ट में जो है वो अल्फाबेट्स, थ्री जो है वर्ड्स के जो है वर्ड्स आ जाएंगे, 3 अल्फाबेट्स के वर्ड्स आ जाएंगे, कैट मैट पैट 1 2 3 4 की स्पेलिंग आ जाएगी, तो आपका पूरा ध्यान उधर चला जाएगा, बट आप जो है वो मिस कर जाएंगे। तो इसलिए या तो आप खुद स्पीच थेरेपी कराइए या स्पीच थेरेपिस्ट के पास जाके उसका ये सेशन जरूर लीजिए। दूसरी चीज ये है कि अगर जो है पॉटी ट्रेन नहीं है तो प्लीज प्लीज जो है एक मेरा पॉटी ट्रेनिंग का वीडियो है, प्लीज वो देखिए और जो है उसके हिसाब से जो है पॉटी ट्रेन कराएं अपने बच्चे को, क्योंकि 5.2 पे पॉटी ट्रेनिंग होना अगर नहीं हुआ है तो ये अच्छी बात नहीं है। और दूसरी चीज है, जो दवाइयां आपकी चल रही हैं वो ठीक चल रही है, एस्प्रिटो चल रही है, शार्प किट चल रही है और एल कार्नोशाइन चल रहा है, ठीक है। सो ये जो है हम कंटिन्यू रखेंगे। इससे अगर हाइपर एक्टिविटी खत्म हो गई है, अभी कंटिन्यू इसलिए रखनी है क्योंकि थोड़ी स्पीच आ जाए, फिर जो है एक बार जो है वो कम करके देखेंगे, अगर फिर भी जो है बच्चा हाइपर हो रहा है तो फिर रीस्टार्ट करेंगे, ठीक है। शहरोज शाह, hello madam, my kid is showing 60% improvement by OT done by Ehsan sir Continua Kids। या एहसान सर का तो नाम ही बहुत है। Do I need ABA therapy as well as, or what I need further to do? I hear ABA therapy needed too for autistic child। So शेरोज मैं आती हूँ वहां पर, आप अगर एहसान सर से ले रहे हैं तो ऑब्वियसली आप जो है बिहार से होंगे, तो जो है मैं जब वहां पर आती हूँ एक बार बच्चे को देख लेते हैं, फिर उसके हिसाब से जो है देख लेंगे कि एबीए की जरूरत है कि नहीं। बट जो है अगर आप जो है बच्चे से ही एहसान सर से बात कर लीजिए, वही आपको बता देंगे, क्योंकि अभी मुझे को फुल इन्फॉर्मेशन इसमें नहीं है। ऐसा नहीं है कि हर बच्चा जो है जिसको ऑटिज्म है उसको एबीए दें, ऐसा नहीं होता है। पहले देखेंगे कि जो है आपके क्या बच्चे में क्या कंसर्न्स हैं, उसके हिसाब से ही जो है एबीए दे कि नहीं दे वो डिसाइड करेंगे, ठीक है। सो एमआर जोन, child is 3.1 years, started babbling from past 2 months, no pointing towards object, no command following, communicates through hand pulling, recognizes alphabet, fruits, vegetable, no crowd fear, what level of autism it is। देखिए ऑटिज्म की जो कैटेगराइजेशन है, मुझे ये बताएं कि अभी ये विद थेरेपी है कि विदाउट थेरेपी है। अगर जो है विदाउट थेरेपी है तो जो है मैं कमेंट नहीं कर पाऊंगी, क्योंकि अगर विदाउट थेरेपी अभी हमने अगर कुछ स्टार्ट ही नहीं किया है तो फिर तो अभी डायग्नोस हुआ होगा। जब हमारा डायग्नोस होता है तो जो है हमें कमेंट नहीं करना चाहिए, बिकॉज ये तो सारे सिम्टम्स होंगे ही होंगे उसके अंदर, तो जो है हम कैसे बता पाएंगे कि आगे जाके रास्ता क्या होना है। अगर ये सारी चीजें इंटेंसिव थेरेपी के बाद भी यही सारी चीजें हैं तो फिर हम मॉडरेट टू सीवियर वाली कैटेगरी में जा रहे हैं, क्योंकि अगर हमें पॉइंटिंग नहीं आई है अभी, और जो है अभी हमने बैबलिंग का, देखिए कई बार हम लोग जिस चीज को बैबलिंग बोलते हैं वो सेल्फ टॉकिंग होती है और वो ऑडिटरी सेंसरी फिनोमिना भी हो सकता है। अगर आते जाते बच्चा जो है ABCD 4 5 7 8 बोल रहा है, तो इसका मतलब ये नहीं है कि जो वो बोल रहा है, इसका मतलब ये है कि उसको जो है जो दिमाग में वो बात अटक गई है वो अपने आप से बात कर रहा है और जो है वो नॉन कंटेक्चुअल है। तो इसलिए कई पेरेंट्स कंफ्यूज हो जाते हैं, वो कंटेक्चुअल और नॉन कंटेक्चुअल में जमीन और आसमान का फर्क हो जाता है हमारा। तो अगर थेरेपी नहीं स्टार्ट हुई है तो प्लीज थेरेपी स्टार्ट करिए, क्योंकि देखिए उसको अल्फाबेट, फ्रूट, वेजिटेबल, नंबर सब आता है, तो इसका मतलब अपना बच्चा जो है वो विजुअल मेमोरी उसकी बहुत अच्छी है। अगर उसकी विजुअल मेमोरी बहुत अच्छी है तो ये मेरे लिए बहुत अच्छा पॉइंट है, दैट्स अ वेरी प्लस 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 पॉइंट। बट अभी पॉइंटिंग नहीं आई है, कमांड फॉलोइंग नहीं आई है, तो इसके लिए मैं थोड़ी परेशान हूँ कि प्लीज जो है आप जो है इसकी थेरेपी कराइए अगर नहीं करा रहे हैं, और अगर करा रहे हैं तो देखिए कहाँ गड़बड़ हो रही है, क्योंकि चेंज करने की जरूरत है। अगर जो है अभी जो है हमने कितने महीने से हुई है ये भी है, अगर एक आध महीना ही हुआ है तो हम इसको कोई जजमेंटल डिसीजन नहीं ले सकते हैं। सो डिपेंडिंग ऑन कि हमने कितनी थेरेपी कहाँ क्या कर रहे हैं उसके बेसिस पे डिसाइड होगा कि हम किस जोन में हैं और हम कैसे हैं। ओके, सो सनी चंदेरवाल, my child is 4 years and 4 months. Doctor diagnosis of ASD of moderate level. He is an issue of sensory overload. We use risperidone syrup 7 drops, but no improvement. He's pinching too much and no pointing, I think. So अगर कोई improvement नहीं आ रहा है तो जो है आप डोज भी बढ़ा सकते हैं, देखिए, क्योंकि अगर इम्प्रूवमेंट नहीं है तो हमें डोज बढ़ा के जो, और साइड इफेक्ट भी नहीं है ना, क्योंकि देखिए हमें दोनों चीजों को बैलेंस करना है। अगर इम्प्रूवमेंट नहीं आ रहा है तो जो है साइड इफेक्ट भी नहीं होने चाहिए। और दूसरी चीज, आप ओटी कितना करवा रहे हैं, क्योंकि देखिए अगर सेंसरी ओवरलोड है तो खाली रेस्पिरिडोन खाली काम नहीं करेगा, आपको उसके साथ में ऑक्यूपेशनल थेरेपी भी बहुत अच्छी, इसको सेंसरी इंटीग्रेशन बोलते हैं, वो भी करानी पड़ेगी और घर पे भी करनी पड़ेगी। ओके, उससे जो है ज्यादा जल्दी फायदा होता है। और अगर 7 से नहीं आ रहा तो उसको 9 करके देखिए, 10 करके देखिए। ओके, अब हम आते हैं साधना सिंह। साधना सिंह, Bhadauria. My daughter is 2.5 years old. She is having few sensory issues like toe walking and mouthing, biting. Please suggest your views on this. And okay, so again मम्मी, अगर सेंसरी कंसर्न्स हैं तो टो वॉकिंग बेसिकली टैक्टाइल फिनोमिना है, माउथिंग जो है वो मेरा ओरोमोटर फिनोमिना है। कई बार माउथिंग जो होता है वो आयरन और कैल्शियम की डेफिशिएंसी की वजह से भी हो जाता है, तो मेक श्योर करिए कि जो है उसको डेफिशिएंसी तो नहीं है, अगर है तो उसका सप्लीमेंटेशन दीजिए। अगर सप्लीमेंटेशन के बाद भी माउथिंग हो रही है तो ओरोमोटर थेरेपी कराने की जरूरत है। टो वॉकिंग के लिए टैक्टाइल थेरेपी की जरूरत है, क्योंकि टैक्टाइल जर्नली होता है टो वॉकिंग। और बाइटिंग का मुझे देखना पड़ेगा क्या ये ओरोमोटर है या बिहेवियर है, किस वजह से बाइटिंग हो रही है। तो अगेन जो है वो तीनों चीजों को डिसेक्ट करिए, और जो है तीनों चीजों के जो ट्रीटमेंट प्रोटोकॉल है वो अलग होंगे। सो आई थिंक आज के लिए हम इतना ही रखते हैं। मैं एक क्वेश्चन जो है और ले लेती हूँ। Rajni Rajput. Ma'am, my daughter is 6 years old. When she was 4.5, I consulted with homeopath doctor. She is now very much better. She has only and only issue is speech. Slowly she is developing her language. So ये बहुत अच्छी बात है, बट मैं आपकी कैसे हेल्प कर सकती हूँ रजनी? आपने क्वेश्चन नहीं डाला, आपने आंसर दिया है, ठीक है। सो आई थिंक उसके बाद का ले लेते हैं। Tabrez Ali, my son is hyperactive and has mild autism. He's on omega and D3 supplements. Again, बस इतना ही लिखा है। Okay. So, okay. देखिए अगर हाइपर एक्टिव है तो साथ में माइल्ड ऑटिज्म है, तो ये मत सोचिएगा खाली दवाइयों से आराम आएगा, आपको थेरेपी लेनी है। प्लीज थेरेपी जरूर लीजिए, आप जहां कहीं से भी बोल रहे हैं। तब्रेज, बच्चे को हेल्प करिए। हाइपर एक्टिविटी है तो उसको स्पोर्ट्स में डाल दीजिए। कई बार बच्चे जो है स्पोर्ट्स में बहुत अच्छा करते हैं और जो है उनसे हाइपर एक्टिविटी काफी कम हो जाती है। ओके, सो आई थिंक एवरीबॉडी इज टेलिंग मी कि कैसे कर रहे हैं। ओके, सो तेजल, यहाँ पर जो है एक नंबर आ रहा है, आप जो है उनको कॉल कर सकते हैं। तो बेसिकली तेजल इज आस्किंग की जो है हमने डाउनलोड कर लिया है ऐप, बट ये नंबर चल रहा है 8800980055। आप इस पे कॉल कर लो और जो है वो आपको हेल्प कर देंगे बुकिंग एन अपॉइंटमेंट के लिए। ओके, सो लास्ट है शुभंदा। मैम, मेरा बेटा टच पसंद नहीं करता है, मतलब कि घर के स्कूल टीचर का हाथ लगाना पसंद है, जरूरत है तो हाथ लगाना पसंद है, बट बच्चों के साथ खेलना, शेयर करना पसंद नहीं है। अगेन मम्मी, बहुत छोटा सा लिखा है आपने, बच्चे की डायग्नोसिस क्या है, क्या उसका जो है कुछ प्रॉब्लम है उसको टैक्टाइल से, या उसको सोशल कम्युनिकेशन की प्रॉब्लम है। ये सारी चीजें हमें जब तक ज्ञान नहीं होंगी शुभांगा, हम नहीं आपकी हेल्प कर पाएंगे। अगर टैक्टाइल की दिक्कत है, चलिए मैं मान के चलती हूँ कि उसको पसंद नहीं है कोई उसको टच करे, तो कैसे करना है, गोद में जो है मतलब दूर बैठाना है उसको, उसका जो है वाटर कलर होते हैं, वाटर कलर लेके पानी में डुबो के कलर, और धीरे धीरे गुनगुनाते हुए उसका बॉडी पे कहीं यहाँ टच करके कहीं यहाँ टच करके, तो धीरे धीरे हम उसको बोलते हैं टैक्टाइल स्टिमुलेशन। और आप जो है उसको गाना गाते गाते बोलेंगे तो उसको थोड़ा सा अटेंशन आपके गाने की तरफ जाएगा। इन द मीनवाइल आप उसको हल्के हल्के हाथ से जो है वो रब करेंगे, तो वो टैक्टाइल सेंसेशन को आपको हेल्प करता है। मेक श्योर कि जो है अपने घर में जो है आप अलग अलग टैक्टाइल्स की जो है वो कर लीजिए, जैसे घास होती है उस पे बच्चे को चलाएं, थोड़ा सा पत्थर टाइप पथरीली जगह है वहां चलाएं, मिट्टी पे चलाएं, तो उससे वो सारे टैक्टाइल सेंसेशन मिलेंगे। अलग अलग टैक्टाइल चीजों के लिए जो है वो पैचेस आते हैं, ब्रशेस आते हैं, आप उनसे भी जो है वो जो है उसको टैक्टाइल से जो है वो कर सकते हैं मैनेज। और कई बार बच्चे नहीं छूना देते हैं, इसलिए मैंने आपको ब्रश का बोला कि जो है बड़ा सा ब्रश लेके उसको धीरे धीरे इधर से कभी उधर से कभी इधर से कभी इधर से अगर हम टच करेंगे, और प्लस साथ में जो है कुछ गाना भी गाते जाएंगे, तो उसका ध्यान हमारे गाने की तरफ होगा और हमें उसको एहसास हो जाएगा कि कोई बात नहीं, टैक्टाइल से कुछ नहीं होता है। और धीरे धीरे करके आप उसको अपने पास में लाके गोद में बैठा कर भी ऐसा कर सकते हैं, और ऐसा ही मैडम भी कर सकती हैं, ऐसा ही थेरेपिस्ट भी कर सकते हैं। तो इससे जो है वो टैक्टाइल जो है वो कम होता जाता है। आज के लिए हम इतना ही जो है बात करते हैं, और जो है मुझे उम्मीद है कि प्लीज आप मुझे अलग अलग जगहों से, बाहर बाहर से, सब तरफ से जो है लोग जो है वो बहुत छोटे छोटे बच्चों को लेकर आ रहे हैं, मुझे सच में अच्छा लग रहा है। और दो दो तीन तीन महीने में बहुत ड्रामेटिक इम्प्रूवमेंट आ रहा है। सो आई थिंक एवरीबडी इज हेल्पिंग एवरीवन, जस्ट एक दूसरे का सहारा बनिए, एक दूसरे को जो है बातें शेयर करिए और अपने बच्चों को ठीक करिए। Thank you so much. Thank you so much for patient hearing.